Hi, today we are going to discuss about cyanosis. Now, what is cyanosis? Cyanosis is the bluish discoloration of the skin and mucous membrane due to presence of the increased amount of the reduced hemoglobin greater than 5 gram per deciliter or of hemoglobin derivatives such as sulfahemoglobin and methemoglobin in the capillary blood. See, here there is bluish discoloration at the tip of the fingers, at the nail beds, and at the dorsum of the palm. So, this is a clinical picture of the cyanosis. It is actually showing the peripheral cyanosis. Later we will say what is peripheral cyanosis and the types of this cyanosis. Cyanosis came from two Greek words. One is cyanos and one is osis. Cyanos means dark blue color and osis means condition. It is a condition where dark blue color develops in the skin. Now, the types of the cyanosis. There are two types. One is peripheral cyanosis and another one is the central cyanosis. What is peripheral cyanosis? There are two criteria. One is arterial partial pressure of the oxygen should always be normal at peripheral cyanosis. But there is oxygen unsaturation at the venous end of the capillary. Now, why peripheral cyanosis develops? Due to microcirculation defect, the peripheral cyanosis develops. Let's have a look about the causes of the peripheral cyanosis. These are the causes: exposure to the cold, congestive cardiac failure, shock or peripheral circulatory failure, Raynaud's phenomenon, frostbite, venous obstruction due to deep venous thrombosis, hyperviscosity syndrome such as multiple myeloma, polycythemia and macroglobulinemia, cryoglobulinemia, mitral stenosis and septicemia. Now let's see about central cyanosis. What is the criteria of central cyanosis? The partial pressure of the oxygen at the arterial end should be less than 85%. The partial pressure of the oxygen at the arterial end is decreased, and if it is less than 85%, the features of the central cyanosis develops. The central cyanosis can occur in two ways. It can occur due to imperfect oxygenation of the blood in the lungs or admixture of the venous and the arterial blood. Now, what are the causes that will cause imperfect oxygenation of the blood in the lungs? They are acute severe asthma, COPD, respiratory failure, acute respiratory distress syndrome, respiratory depression in case of the opium poisoning, lobar pneumonia, fibrosing alveolitis, acute pulmonary thromboembolism, acute laryngeal edema. Now, the causes that will cause admixture of the venous and the arterial blood. These are seen in the congenital heart defects such as tetralogy of the Fallot, transposition of the great vessels, Eisenmenger syndrome that is developed in the long-standing VSD, where we will see right to left shunt instead of left to right shunt in VSD. Absolute increase in the desaturated hemoglobin seen in the polycythemia that will also leads to central cyanosis. Now, the sites to be looked for peripheral cyanosis. These are the sites where you can see the bluish discoloration in case of the peripheral cyanosis. They are the tip of the nose, ear lobules, outer aspect of the lips, chin and the cheeks. Mind you, the outer aspect of the lips, tip of the finger and the toes, nail bed of the fingers and the toes, palms and soles. See, in the inner aspect of the lips, we will see central cyanosis, but at the outer aspect of the lips, we will see peripheral cyanosis. Similarly, the sites to be looked for bluish discoloration in the central cyanosis. Their tongue, mainly in the margins as well as the undersurface. Mind you, the undersurface of the tongue, inner aspect of the lip, not outer aspect. At the outer aspect, we see peripheral cyanosis. See here, outer aspect of the lips. Mucous membrane of the gum, soft palate, cheeks, lower palpebral conjunctiva. Except these areas, we should, in a patient we are suspecting for central cyanosis, we will also see the sites where peripheral cyanosis develops. Why? Because the deoxygenated blood circulates everywhere in the body. The patients with central cyanosis will also cyanosed peripherally. That's why you should always look for the sites where peripheral cyanosis are looked for in case of the patient with central cyanosis. Now, what is the differential diagnosis of the bluish discoloration of the body? Number 1, carbon monoxide poisoning. Second is the argyria. What is argyria? Deposition of the silver salt in the skin due to silver poisoning, and it will causes bluish discoloration in the body. Let's have a look about argyria. See, in this person there is slaty green appearance of the skin of the face. It is seen in the argyria, that is silver poisoning. Here is the deposition of the silvers that will mimics about cyanosis. In case of the osteogenesis imperfecta, you will get bluish discoloration at the sclera, not in the whole body. You will see bluish discoloration at the sclera. Why? See, the osteogenesis imperfecta, what happens? There is deformity in the formation of the bones. There is this scoliosis curves, you can see here in the vertebral column. But bluish discoloration of the sclera is also seen in the osteogenesis imperfecta. Why? The sclera in the osteogenesis imperfecta becomes very thin. That's why hemorrhoidal blood vessels imparts a blue hue through this sclera. So the sclera becomes blue. It will mimics cyanosis. And amiodarone intake. Amiodarone intake will also causes scleroderma. See here, the amiodarone intake will causes bluish discoloration of the face, of the skin. It is also a differential diagnosis of the cyanosis. Now, how you will differentiate between central and the peripheral cyanosis at bedside? So, the first feature, what you should look for, the sites. The central cyanosis, where it develops? The central cyanosis is seen in the warm mucous membranes like tongue and the oral cavity. But peripheral cyanosis never be seen in the tongue. If you do handshake with a patient of central cyanosis, what you will feel? Hand feels warm due to increased blood flow. In the central cyanosis, the blood flow to the periphery does not hampers. But in the peripheral cyanosis, what happens? Due to, I had said that there is deep venous thrombosis, and that will interfere with the blood flow to the periphery. That's why hand feels cold when you will handshaking with peripheral cyanotic patients. So, because of the diminished blood flow, the hand feels cold. Application of the warmth and the cold. If we apply warmth or cold to the central cyanotic patient, there will be no change. But in the peripheral cyanotic patient, warmth will decreases the cyanosis, but cold increases the cyanosis. Application of the pure oxygen for 10 minutes. If we apply oxygen for 10 minutes, the central cyanosis improves if it is due to imperfect oxygenation of the blood in the lungs. But if it is due to admixture of the venous and the arterial blood, it will not improve. See, here is the cyanosis may improve in the central cyanosis, but except in the AV shunt, that is the arteriovenous shunt is if arteriovenous shunt is there, the central cyanosis will not improve if you apply pure oxygen for 10 minutes. In case of the peripheral cyanosis, there will be no response at all. Clubbing and the polycythemia usually present in the central cyanotic patient, and in the peripheral cyanosis it is absent. Pulse volume. What about pulse volume? Normal or the high due to arteriovenous shunt. In the central cyanosis, the pulse volume will be high, but in the peripheral cyanosis, it is usually low volume due to circulatory stasis. Dyspnea. Patient is often breathless in the central cyanotic patient, but at the peripheral cyanotic patient, there is no respiratory distress at all. Thus, you can differentiate between central and the peripheral cyanotic patient. Thank you.